Hi everyone, my name is Dr.Mazhar and today I just would like to talk about in rheumatology. I would like to talk about the osteoarthritis, very common disease present in the old age, very common present in the old age. So in that disease what happens, there is an inflammation of joint due to breakdown of bone cartilage. When bone cartilage become destroyed, that destruction of cartilage which eventually finally lead to joint inflammation and space between joint become reduced. So it's a degenerative type of condition in the old age. It's a age related condition, you can say that, because in the 40s plus or 50s plus age in the female or male, so joints become used so much, so it can lead to eventually breakdown of cartilage. So osteo mean bone and arthritis mean joint inflammation. Now you can see in that anatomy of knee joint, this is a simple anatomy: anterior cruciate ligament, posterior cruciate ligament, and then lateral meniscus. This is a disc, you can say that, and this is a medial meniscus. Then there is a transverse ligament. This is the patellar ligament. There is a patellar bone which patellar bone connected with bone through patellar ligament, and then there is a tibia, and there is a fibula, and there is a bicep femoral tendon. So this is a simple anatomy of knee joint. So in this simple anatomy of knee joint, when this anterior cruciate or posterior cruciate ligament sometimes destroy and movement become less, but in the osteoarthritis what happens, there is a cartilage on the end of the bone. So when this cartilage become destroyed, so this can lead to the joint inflammation. So this is a very important thing. So what's the physiology of knee joint? The physiology of the knee joint is that what's the movement of knee joint? This is a movement, you can say this is a flexion and this is a extension, then there is a lateral rotation, and then there are hinge type. So these are the, just you can say it's a movement of the joint. So when there is a osteoarthritis, so this movement become less, very less. So what are the causes? Now we are talking about causes. The causes of osteoarthritis is the, which you can say secondary osteoarthritis, not a, mean that osteoarthritis due to that condition. First of all, obesity, very common, because due to obesity it put pressure of joints and bones and finally leads to what? Inflammation or destruction of cartilage. Then trauma can happen, because if some traumatic injury can happen, so it can also lead to this. Also surgery, any previous surgery can lead to this thing. Any knee joint surgery or any hip joint surgery can lead to, but very rare. And abnormal joints like any rickets or any calcium deficiency, or you can say when there is a any pathological problem, any congenital problem can lead to abnormal joint, and this can lead to osteoarthritis. Then there is a gout, very important. In the gout what happens, there is a uric acid, increased uric acid level. So when there is an increased uric acid, so it can lead to accumulation of uric acid in the joints, and it lead to eventually gout. So this is the, we can say, hyperuricemia lead to gout. Then there is a diabetes mellitus and hormonal disorder. These are also very important thing for this thing. Now we are talking about the common risk factor for knee osteoarthritis. First of all, female sex. Why? Because female most of the time they work so much in their homes, they're working, like they walk very fast like this, so they also mostly of the time taking stress, and they use joint, walk, running. So exercise activity can lead to this thing. In my next lecture I will further continue this thing. For now, thank you so much.